Sure. Thank
Okay.
you. Just let me know when we can start, or
Sure.
I'll wait for the.
Absolutely. We will let you know. And I must try and visit your practice when I'm there.
That'll be lovely. It'll be. I was just going to say that when you're here on 8th, and where are you staying?
The Leela
Okay, in Andheri. Okay, fine,
in
fine. So
Andheri.
let's
We'll
try
find.
to meet once you're here.
We
We'll
will.
probably touch base closer to the time.
Super. Super. I think we're on. Is it 6 o'clock, Rajiv?
Yes, sir. 6:01.
Lovely.
Yeah.
Good evening, everybody. It is 6 o'clock on a Wednesday, and that means it is time for the Diabetes Chai Chat. We've been off the air recently simply because we've been undertaking a number of other projects on a Wednesday. We've been to Essex, where we've had a day of action in the county of Essex with a number of people attending and our partners, Neon Diagnostics. We've also, of course, continued to have the usual operation going on at Uppingham Road in Leicester. So we're back for a look at dentistry and diabetes. Some of you have joined us on the program as participants. Others are part of the live streaming that we are doing with the Chai Chat. So welcome to all of you. Our guest speaker is in Mumbai as we speak, so it's quite late on there. It's about 11:30, but we'll be coming to him shortly. In the meantime, just to remind you that from round about the middle of April, we will be starting diabetes testing in our headquarters at 201 Uppingham Road. We'll let you know when that is, and we will publicise it so friends and family can drop in during those 2 hours and get tested at our headquarters. In the meantime, could I welcome our guest speaker today, Dr. Chetan J. Somaiya. He is a dentist, a cosmetic dentist, and a dental surgeon. He's highly experienced professional with over 24 years specializing in dental implants, crowns, and bridges, full mouth rehabilitation, implant supported as well as conventional dentures. His core values center around ethical treatment, patient comfort, and staying updated with advancement in dentistry. He holds a number of degrees, including a master's in dental surgery. He is the proprietor of the Dental Place in Thane, near Mumbai in India, where he ensures top-tier care for his patients. He's very passionate about educating diabetic patients such as ourselves on the critical link between diabetes and oral health. So let us give a welcome to Dr. Chetan Somaiya. Thank you for joining us, Dr. Somaiya. We know you're very busy. We know it's very late in Mumbai, but thank you for being with us. The floor is yours for 15 minutes. You are going out on a live stream, but there are people who have joined our roundtable to ask you questions. Welcome to Chai Chat. Please begin.
Thank you so much for the warm welcome. Thank you very much. Appreciate it. A very, very warm welcome to all the participants on this program. And I would like to kind of just highlight the importance of oral health. This comes very much in general, but more so particularly with diabetic patients for a variety of reasons, which I will highlight to you. I don't want to get into the intricacies of how and why, what happens with diabetes, but essentially, as you are aware, there is glucose impairment, and that happens mainly because the pancreas, which is behind the stomach, aren't able to create enough of insulin, which is basically the key for glucose to enter the cells, which is required for energy. And it's a deficit mechanism between a key and a hole. So there's either a problem in creating insulin or a problem in the insulin getting into the cells, which could be because of a blockage with fat around the keyhole there. So all said and done, this happens, but what are the implications of this to a person with diabetes? So, what are the presentations that can be seen in a patient with diabetic? I will go through what are the do's and don'ts for diabetic patients with regards to oral health in specific, and what are the warning or trigger signs that if you notice, you may want to flag it past your dentist to begin with if it's an oral symptom. So basically, what happens is diabetic patients in particular are more prone to have what they call gingivitis, which is gum disease, and periodontitis. And periodontitis is the supporting structure of the teeth. The housing in which the root of the teeth gets into is the entire structure is called as a periodontium, which is why it's called gingivitis and periodontitis. The two important, these are the most important two things that are associated with oral disease and gum disease. So uh, the reason this happens principally is that in a diabetic patient there is an the white blood cells are more attacked, and white blood cells are the ones that help fight an immune response, which is why it is said that diabetic patients have a lower immunity as compared to a non-diabetic patients, which is why the onus of meticulous oral health care is extremely crucial to a diabetic patient to ensure that the effects of the high blood glucose that is there in the body is not going to adversely affect oral health. So it is not about uh, a proper disease as such where we say that you are compromised, but it's just making small consistent changes in lifestyle that will help you go a long way even if you are having diabetes. So what are the few dental signs and symptoms that you may notice if you are having diabetes? The most important factor that you may be experiencing or noticing is something called as xerostomia, which is known as a dry mouth. Dry mouth remains one of the most common symptom or a clinical presentation in a patient with diabetes. Now, what happens when a patient has a dry mouth is there is less saliva that is secreted in the mouth, and with less saliva that is secreted in the mouth, there is oral bacteria that tend to thrive because saliva acts like a washing agent to wash away plaque, tartar, food debris, etc. And with a reduced count of saliva, there is more stagnation of these elements around the teeth. And then with oral habits that are not practiced well, which I am going to come to, there is a multiplication of bacteria in the mouth, and eventually this leads to even further progression of the gum disease. So, dry mouth is one of the most important factors. The second one that comes into play is, as I mentioned, the gingivitis, the periodontitis. Thirdly, what comes into play is poor healing of wounds. So it is, we're well aware that there is poor healing of wounds in diabetics in the rest of the body. The mouth is no different. Although the mouth is very forgiving, if you know you have a cheek bite or something, the oral wound heals very quickly. In diabetics, this takes far more longer, which is why you have to be more careful. The fourth presentation that you may notice more or very often is something called as thrush. Now, thrush is a fungal infection caused by the bacteria Candida albicans, which is a very uh, common organism, a bacterial organism that is there in all our mouths. But what happens is the count of the Candida albicans, the fungus, multiplies many-fold in the oral cavity, and the presentations can be as white, painful lesions in and around the mouth, especially in case of denture wearers. So, if you have patients wearing dentures, make sure that the dentures are cleaned at least once every day with tap water. You can use the solutions that come for denture cleansing once a week, but dentures need to be cleaned on a regular basis. And if you have thrush, then you need to visit your local dentist, because there are various gels that can be applied over these agents, that antifungal gels, there are anesthetic gels, there are certain mouthwashes that have a numbing effect that can that can give you relief from the symptoms of either oral ulcers or the thrush that is present in the mouth. The other thing that can happen is something known as a burning mouth or burning tongue, which is a complication of oral thrush. So I'm giving you the presentations of things that may happen, but the key takeaway I want you all to take home with you today is the preventive measures that can be done. Because if these are followed to the T, you can rest assured, even with diabetes present, you can steer away from all these problems, for time to come. So, what are the steps that can be taken to ensure that you don't run into problems with bacteria related specifically to diabetes mellitus? So number one is easier said than done, but a regular 6 monthly visit to a dentist is an absolute must. Now this is very overlooked by most patients, even in India here, and I think it's a little better back home there, but I think 6 monthly checkups are not as common as they should be. So what happens with the 6 monthly checkups is there is a range of a time given to a patient when they should visit a dentist. Ideally, the first time you go, for the first year, they say it has to be once every 6 months. And once you are seen at that time, the time decided by the dentist for you can either become once every 3 months or once every 1 to 2 years, depending on what the dentist feels about your oral hygiene maintenance. If it seems to be meticulous, very good, you may be told to come initially for once in a year, and that can be at the very maximum be once in 2 years. If it's extremely poorly controlled, you may be initially for the first year told to make 4 visits, which is 3 monthly, and then once starts improving, it can be told that you can come in 6 months, and so on and so forth. So that is the one thing. What is done during this 6 monthly visit is, apart from having your oral health checked, there is a procedure called oral prophylaxis, which is the scaling and polishing that is done, which is to remove the bacterial plaque that is mixed with saliva, and that gets calcified to form something called tartar, which is the yellow hard deposits that get stuck around the teeth. Now that's tartar, and tartar will not go as much as you may brush, as much as you may do what you want. Once the deposits are calcified, it can only be professionally removed with the oral prophylaxis procedure, which is the scaling and polishing. So that is the second thing that can be done. So 2 visits initially a year, followed by guided by the dentist as to whatever timelines are decided between him and you. Number two is brushing twice a day. But the most important thing, apart from brushing, I'm sure most people brush twice a day, but the most important thing, which is again overlooked, is dental flossing. Now, dental flossing is something which is, it is said that if you don't floss your teeth once a day, you are probably missing out on cleaning 30% of your teeth surfaces. And because what gets stuck between teeth, your brushes cannot get into the nooks and crevices between teeth. And that's where a dental floss comes into play and removes the thing that gets stuck between teeth. Because I'll show you a model here. Uh, if you all can see this, uh, if you have things that are getting stuck between teeth, I will try to come to the center. If you are getting things that are getting stuck between teeth and brushes can't get there, you have interdental aids, something like this. This is a interdental brush. An interdental brush does the role of going into spaces between teeth. So if you can see this, it just goes in here. I'll show you from the side view so you can look at it here. It just goes in and out into the gaps here. Okay, so it goes in and out into the gaps, and it takes out the food particles that are stuck between teeth where your toothbrush is not going to go. If you want to use something a little more fancy and you find using an interdental brush cumbersome, like many people do, you get something known as a water flosser. And a water flosser essentially does the same role of cleaning between teeth that an interdental brush does. The most simplest form of using it is a dental floss, which you get in packets at the chemist. And you can use a certain floss called a waxed floss. It's got wax so that it slips more easily between teeth and doesn't give you resistance when you're trying to push the floss between your teeth. But whatever method you follow, and we can take a long lecture just on flossing and oral hygiene habits, but what I'm trying to bring to this here is flossing is extremely crucial in trying to maintain. You can kind of buy 5 to 8 years of your life of your teeth if you're somebody who's flossing your teeth every day. It's an extremely important oral hygiene aid, and it will go a long, long, long way for you to maintain the life of your teeth for far, far longer than you would uh, could imagine. So uh, twice a year visiting the dentist, using interdental aids, which is like flossing. And the other thing you can do is do not leave vacant spaces into your mouth. Now, I know we all have 32 teeth, and when we end up getting one or two teeth extracted, what we tend to do is we try to use the other side. We try to juggle around as to see where food chewing is more comfortable, but we tend to leave the gaps in our mouth where teeth are missing. Now, unless and until it's a wisdom tooth which has been removed or extracted because of various reasons, that wisdom tooth need not ever be replaced. Leaving apart a wisdom tooth, any other tooth that is extracted from your mouth should always be replaced as soon as possible, so as to maintain the balance of the teeth as a unit, because they do function as a unit. It's like a pack of cards. You build a house, you take any one card out, there's a collapse of the rest of them. So the same goes with teeth. When you lose a particular teeth, barring the wisdom tooth, and you leave a gap for any longer than 4 to 6 months, you have the neighboring teeth that start moving into that gap. You have the top tooth that starts moving down into the space where the lower tooth was once present. And that causes a change in the way you bite your teeth together. That eventually will start causing you jaw joint disturbances, temporomandibular joint pain, neck pains, shoulder pains, and very few will relate this to happening from a missing tooth that is causing these problems. So don't leave on a missing tooth that's present in your mouth. Have it replaced at the soonest. Now, I want to address another very important point here. Is there is a bit of a misconception that you cannot have dental implants if you are diabetic, but that is not correct. Uh, Having diabetes is not an absolute contraindication, but it is a relative contraindication. Now, what does a relative contraindication mean? Is if you are a very, very well controlled diabetes. Now, that is checked with your HbA1c levels, which are taken on a regular 6 monthly intervals, which gives us an idea of how well your blood sugar is maintained over a 3 month period. If your HbA1c levels are 7 or lower than 7, it means that your diabetes is reasonably well controlled, and you can look into the possibility of having dental implants. Following good oral hygiene habits, visiting your dentist every 6 months, making sure you don't have any collection of bacterial tartar plaque in your mouth. And if you follow your normal regimes of your taking your tablets, of course, with the regular exercises, a good diet, balanced diet, there is absolutely no way you can have an HbA1c that will come up as 8.5, 9, etc. Now, if you try to see the broader picture, a good balanced diet, regular exercises, that is not only for diabetics, it is for every individual, whether you are diabetic or not. So it's not that the onus is more on you to do something. It is just that the effects of those good habits are far more beneficial to you than they would be to somebody else. So a diabetic patient shouldn't look at it like we've got to do so much and the others don't. It is not like that. It is the same protocol that should be followed by every individual, whether you're diabetic or not. But for you as a diabetic patient, it will go a long, long way in your overall diabetes control as well as your oral health, which will have a link to your overall diabetes control as well. So uh, I am doing a lot and lot of implants on a daily basis for a lot of patients who are, of course, from my neighboring area, but I do have a lot of patients from abroad, US, UK, and other countries that come for implants via the dental tourism. But the idea is you have a proper scan to check whether the bone levels are of reasonably good quantity and quality. So there is a scan called as a CBCT scan that is done for all patients having dental implants. You have that scan, and nowadays the dentistry has advanced leaps and bounds. So I at my practice, I do all my implants guided. Now, what is a guide? A guide is like you have a stencil. A child would write ABCD with a stencil. So through the CBCT scan that you have done, which is just like a CT scan of the body that you do, a dental CT scan is called a CBCT scan. Through that CBCT scan, we are able to create a guide. And with that guide, what we do is we place that guide in your mouth. It is custom made to fit only your mouth. It is placed in your mouth only for about 10 minutes during the procedure of the implant. And without any cutting of the tissues, without any stitching, we just place the implant through the guide. It's like a keyhole surgery that you have in general surgery, general medicine. When you go to hospitals, they say we do a keyhole surgery. It's a extremely minimally invasive procedure to do dental implants. Now, this is a very big advantage for diabetic patients, because if you have poor healing of oral wounds, the idea of a guided surgery for a diabetic patient is that you're essentially not creating a large wound at all to begin with. So the onus on the body to heal that is far lower than if you have a fully fledged surgery where a full cut is done, etc., etc. So advances in dentistry are such that the procedures can be done in a far minimally invasive way. And I don't just do this for diabetic patients, I do it for each and every single patient, whether it's a patient requiring 10 implants at one time or you require one implant. I do all my implant procedures here with the guide, and it makes life very easy for the patient. Maintenance becomes easy, and post operative discomfort, etc., is almost minimal. Most of my patients having dental implants, I have a habit of calling up my patients the next day, and 95 to 98% patients on day 2 of the surgery, they are not taking painkillers. So it's because it's how the tissues are handled in the mouth. If there is a lot of pulling and pushing, then the healing time also takes a little longer, even for routine patients, and a little longer for diabetic patients. So um, simple keys are: don't leave gaps in your mouth, have regular checkups with your dentist. That is the most important takeaway point you can take away from today, is start seeing your dentist minimum 6 months time. If it's already been 6 months since you've last seen your dentist, make your next visit immediately. And once you're there, you follow the protocol that is set by your dentist. In UK, you have hygienists who see you for your oral prophylaxis procedures. So once your dentist sees you, he will direct you to the hygienist who will do your routine cleaning. And once you follow what is told to you, whether it's initially to come every 3 months or 6 months, once you do that, at least you can ensure your oral symptoms related to diabetes are not something that will cause you problems long term. And that is
Thank you.
a big, big, big win for you also.
Thank you very much.
Thank you. Thank
Thank
you.
you so much, Dr. Samaya, for that very, very full and very
I hope it was
comprehensive.
informative.
It was very informative and very comprehensive, and we're extremely grateful to you. We've not had a dentist to talk about diabetes, I think, in the last 6 months. So we are really, really grateful to have you
Thank
on.
you. Thank you.
Thank you. Can I just check if there are any questions on the panel, those who've joined us? I think Can Kugasinen has come on, and the yellow hand is up. So let's hear first of all from Can, who has a question to you,
Sure, sure.
Dr. Samaya. Can.
Thank you very much indeed. I just want to ask a quick question. You were talking about dry mouth. In fact, I do have the same problem. So how we can overcome that problem by not taking medication?
Okay. Now, what happens is dry mouth is caused for a variety of reasons. Number one, there are many diabetic medications that diabetic patients are taking, which itself have a side effect of causing dry mouth.
Yeah.
So you can, number one is you can check with your physician or your diabetologist who is prescribing you the medications, whether if the any of the side effects of the medications that you are taking are ones that cause dry mouth. And number two is there an alternative? Is there an alternate medication that you can take which can cause a lesser symptom of a dry mouth than you are having initially or not? If what you are taking is what you need to take, then you have oral salivary substitutes that are available in the market. I'm sure they're available there as well. So
Yeah.
they are salivary substitutes that come in the form of a mouthwash,
Yeah.
and using them kind of keeps your mouth moist. You get even lozenges, you get mouthwashes, and using those on a regular basis can ensure a more moist mouth, which will help you from the symptoms of dry mouth. So
Right.
it's a combination of the two things that could be done to help you.
Is it connected to dry eye as well? Is it
Yeah.
too?
So yes. So now what happens is the basic problem with diabetes affects all the cells of the body, because you have the glucose that cannot enter the cells that are affected. But there are only three cells in the body that are not affected with diabetes, and that is because those cells do not rely on insulin to enter into the cells, which are the eyes, the nerves, and the kidney. Now, because these three cells in the body don't rely on insulin and they do receive all the glucose that is in the body, um, because they receive all the glucose which the rest of the body is deprived from, you have the nerves, and that nerves starts in the extremity. So you have the foot of the patient that is the most affected in diabetes. That is because the nerves get affected, the eyes get affected, and the kidneys get affected, because the kidney is overworking to remove the extra glucose that is lingering in the body, and it cannot do that, which is why the kidney gets affected. The eyes get affected because the arteries and nerves of the eyes get affected because of the excess of glucose, and the nerves of the feet get affected, which is why the diabetic foot is a very common symptom in people with diabetes.
Okay. Thank you very much.
Most welcome.
Okay, thank you. A question that's come through by somebody who is watching the live stream is a question to you, Dr. Samaya.
Sure.
What is the last thing we should eat at night before we go to bed? I
Perfect.
tend to have a cup of tea, I personally. I don't know whether the questioner has that. A cup of tea, usually green tea. Sometimes I pop a little chocolate into my mouth when I
Okay.
check on my blood sugar levels. What is the last thing that we should eat at night to keep our mouth fresh and to make sure that it is not too sugary?
Right. So ideally, what we recommend patients is you have to brush twice a day after you finish your food at night, which is before you do your second brushing. You eat and drink whatever you have to. If you are in the habit of having something sweet, do that after you eat your food. And once you finish that, you go for your second brushing. After you brush your teeth at night and you floss, which is supposed to be done once a day, there mustn't be intake of anything apart from water. So do whatever you want to eat, drink, whether it's a green tea or a regular tea or a piece of chocolate or a non-sweet kind of a chocolate. But after that, when you brush, you must ensure after you brush your teeth at night and after you floss at night and possibly use a mouthwash, there mustn't be intake of anything apart from water. Because what you tend to do is once your teeth are clean, in the night when we sleep, our tongue and mouth doesn't move. That's when the bacteria have the maximum time to move around the mouth and multiply. But when they have a clean mouth with nothing on them, the kind of don't get much to thrive on. So the effects of those bacteria around the mouth at night in a clean mouth is very, very, very minimal. But if you've done your brushing, flossing, mouthwash, and you end up having a small piece of chocolate before you sleep, it kind of defeats the whole purpose of brushing at night. So the last thing you can have before you go to bed after you have brushed is only water.
Excellent. And then one other question has come through to you, which is the issue of what should you drink first thing in the morning in order to keep your teeth in good order. The writer in has suggested it should be tap water, lukewarm water, with a slice of lemon in. What do you suggest first thing in the morning? Obviously, brushing teeth is very important, but in terms of drinking?
There is no specific kind of indication of whether if having a particular drink would be more beneficial than the other with regards to oral health. I'm being specific to oral health, not to do with how it helps your diabetes. But I mean, in fact, anything that you're used to in the morning, as long as it's you're taking care of the sweet part of it, it's got less sugar, or it's a non-sweet kind of a drinks. A lot of people prefer having green tea in the morning with some honey in it. But again, you got to make sure about the sugar content of whatever you're having. But so long as you've brushed your teeth in the morning and you're having something that you're used to having, whether it's black coffee or green tea or regular tea or coffee or honey with green tea, it should be fine. There is no kind of ideal drink that you can have in the morning to kind of help better oral health per se.
Okay, wonderful. Dr. Somaiya, thank you so much for joining us.
Most
We're very
welcome. It was a
grateful.
pleasure.
We look forward to meeting you in Mumbai when Silver Star
Yes,
comes there in April.
definitely. It would be
And
great.
you're welcome to stay for the rest of the program. We have the headlines, and then we will be closing. So thank you so much.
Thank you so
It
much.
must be midnight
Yeah,
at the
it is
moment in
just
Mumbai.
exactly midnight now. Yes,
Oh,
yes.
right. It's time you went to bed to see your
Yeah,
first
yeah, no
patient in the
problem. It was
morning.
absolute pleasure to be with you all, and thank you so much for having me over.
Thank you, Dr. Somaiya. From Dr. Somaiya, let's go back to the Silver Star Centre in Leicester. And I think Rajiv has the headlines for us, our 3 top diabetes headlines of the week. Rajiv, are you there?
Sir, news headlines of the week. A daily dose of just 3 grams of cinnamon may help alleviate symptoms of diabetes, according to experts. Cinnamon is rich in phytochemicals which are responsible for its potential to combat tumors, cancer, diabetes, and high triglyceride levels. Next headline, lesson on diabetes warning. You may notice at night. Diabetes UK have highlighted that frequent urination, particularly at night, can be a symptom. Other potential signs include extreme thirst, unusual fatigue, unexplained weight loss, blurred vision, slow healing of cuts or wounds, and genital itching or thrush. The next headline, craving chocolate could signal a serious health condition. If you often crave sugary foods like cakes, biscuits, or white bread, it could mean your blood sugar levels are unbalanced, suggesting this might indicate insulin resistance or the onset of type 2 diabetes. Because when your blood sugar drops too quickly, it makes you crave sugar as a fast way to boost your energy. If this continues, it can increase your risk of developing type 2 diabetes. Thank you.
Thank you so much, Rajiv, for that. I should say for everyone, it was Rajiv's birthday this week. So happy birthday to you, Rajiv.
Thank you, sir.
We did give him a cake. It was not sugar-free, but it was eggless. And I had a bit to eat. So happy birthday to you.
Thank you, sir.
Before we close, just to remind you that from mid-April, there is going to be testing every week at the Silver Star headquarters, which has been refurbished at 201 Uppingham Road for a couple of hours each week. We haven't decided on the date. Next Friday, the 4th of April, the mobile diabetes unit will be at the Evington Goodwood Mosque, the Goodwood Islamic Centre, from about 1 till 3, where people can be tested after the Ramadan festivities, after the Eid festivities and the Ramadan holy month. As we do in Diwali and at Christmas, we go to places of worship, which makes it easier for people to be tested. So if you're around the Goodwood area, then let us know. If you want the mobile diabetes unit to visit your street, we can visit your street. If you send us the details to Rajiv on the app or by email, we will make sure we come to your street and visit you. But we will expect a cup of sugarless tea if it's your street when we come to your house. In the meantime, thank you so much for joining us. The time is just past 6:30. Thank you to Dr. Somaiya. Thank you to Rajiv and his team, and to all of you for joining us. We will see you all again in a fortnight's time.